As people get older, their daily routines often need to change. And one common question for those over 70 is how often they should take a bath. This isn't just about staying clean, it's also about keeping the skin healthy, staying safe in the bathroom, and feeling comfortable. In this article, we'll look at the important facts and health tips that can help seniors figure out how often they should bathe. Number 1. Should seniors over 70 bathe every day? Many people grow up with the idea that taking a bath or shower every single day is the healthy thing to do. It becomes a habit, something we rarely question. But once someone reaches the age of 70 or older, this routine might need a second look. Daily bathing, while it seems like a good way to stay clean, might not always be helpful, and in some cases, it could actually cause more problems than it solves. As the body changes with age, so do its needs. For seniors who aren't moving around much or aren't sweating a lot, taking a full bath every day may dry out the skin or raise the risk of slipping and falling in the bathroom. These risks are real and can affect both comfort and safety. That's why, instead of sticking to a strict daily routine, it's better to consider the person's overall health, activity level, and skin condition. Creating a bathing schedule based on those personal details will lead to better results and fewer problems. This brings up an important question. Why exactly does older skin need a different kind of care? Number 2, why older skin needs special care as we age. Our skin goes through a number of changes that can make it much more fragile than it used to be. After age 70, these changes become even more noticeable. The skin becomes thinner and loses some of its natural oils, which help keep it soft and smooth. Without enough of those oils, the skin dries out faster and is more likely to feel tight, itchy, or uncomfortable. Also, older skin doesn't bounce back the way younger skin does. It loses stretchiness, and the layer of fat beneath it gets smaller, making bruises and bumps more common. The skin's ability to heal slows down too, which means that small cuts or scrapes may take longer to go away. When someone bathes too often, especially with hot water and strong soaps, these problems can get worse. The skin becomes even drier, which can lead to flaking, small cracks, and pain. And once those cracks appear, it's easier for bacteria to get in and cause infections, which can be harder to treat in older adults. This is why less frequent bathing, with gentle products and warm, not hot water, can actually do a better job of keeping skin healthy after 70. Number 3, how often should seniors bathe? Because of how sensitive older skin becomes, many doctors who work with seniors, including dermatologists and geriatric experts, suggest that taking a full bath or shower just 2 to 3 times a week is often enough. This helps keep the skin clean without stripping away its natural oils too often. When done right, this bathing schedule still keeps the body fresh and lowers the risk of skin dryness or irritation. However, this isn't a strict rule. It's more of a starting point. Every person is different. For example, someone who lives in a very warm or humid place may feel the need to bathe more often. Someone who exercises daily or spends a lot of time outdoors might also need to rinse off more frequently. On the other hand, people who have very sensitive skin or limited mobility might do better with fewer full baths and more partial cleans. What really matters is finding the routine that works best for each person. It should leave them feeling clean and comfortable, while also protecting their skin. But what about the days in between those full baths? Number 4, keeping clean without a full bath. Even when full baths or showers don't happen every day, staying clean is still very important. That's where partial bathing, also known as a sponge bath, comes in. This method lets someone clean the parts of the body that need the most attention without going through the full process of bathing from head to toe. The areas that should always be cleaned include the face, underarms, private areas, buttocks, and feet. These are the parts of the body that are more likely to collect sweat, oils, and bacteria. Using a warm, damp cloth and a gentle, non-irritating soap is usually enough to keep these areas clean and healthy. Sponge baths are not only easier on the skin, they're also less tiring and much safer for seniors who may struggle with balance or energy. This type of routine helps seniors feel fresh and comfortable every day, even if they're not stepping into the bath or shower. It's a smart and gentle way to maintain hygiene while giving the skin time to rest and heal between full baths. Now, with bathing routines adjusted, the next important step is making sure that bath time is as safe as possible. Number 5, staying safe while bathing. After 70, for people over 70, bathroom safety is very important. Falls in the bathroom can lead to serious injuries. That's why it's important to make sure the bathroom is safe, no matter how often someone bathes. Installing grab bars near the shower, tub, and toilet can help with balance. Putting non-slip mats inside the tub and on the bathroom floor can also stop slipping. Using a shower chair or bath bench lets seniors sit down while bathing, which is safer and easier. A handheld shower head can help control where the water goes, especially while sitting. It's also important to check the water temperature, since older skin burns more easily. Good lighting in the bathroom helps people see clearly and avoid accidents. These simple changes make bath time safer and more comfortable. What about the soaps and skin products that seniors should use? Number 6, choosing the right products. When it comes to caring for skin over 70, picking the right soaps and cleansers isn't just a small decision. It's a vital part of daily health. As the skin becomes drier, thinner, and more sensitive with age, using harsh products can do more harm than good. Strong soaps or anything filled with perfumes or alcohol can easily irritate or dry out the skin even more, removing the little natural oil the body still makes. Instead, choose soft, fragrance-free soaps or body washes made especially for sensitive or dry skin. These products are gentle enough to clean without causing damage. Lukewarm water, never hot, is best, as hot water strips the skin of moisture even faster. After bathing, it's important to gently pat the skin dry with a soft towel rather than rubbing it. Then, while the skin is still slightly damp, apply a thick layer of a mild, scent-free moisturizer. This step is crucial as it helps seal in moisture and keeps the skin feeling soft, smooth, and protected throughout the day. Of course, while careful bathing helps, too much of it can lead to a different set of problems. What happens when someone bathes too often? Number 7, when clean becomes too much. Though it might seem like a good habit, bathing too often, especially with hot water and strong soaps, can actually become risky for seniors over 70. When skin is washed too frequently, it can dry out badly. A condition known as xerosis. This dryness strips away the skin's natural barrier, leaving it cracked, rough, and unprotected. Dry, cracked skin is more than just uncomfortable. It can lead to intense itching that makes it hard to sleep or sit still. Worse yet, the small cracks in very dry skin can allow germs to sneak in, leading to infections like cellulitis. Overbathing can also make chronic skin issues, such as eczema or psoriasis, much worse. Constant exposure to water and soap may slowly damage the skin's ability to protect itself, making it more reactive to allergens and irritants in the environment. So while staying clean is important, there's a real danger in doing too much. But what about the other side of the coin? What happens if someone doesn't bathe enough? Number 8, the risks of not bathing enough. Just like bathing too often can cause problems, not bathing often enough can also lead to serious issues. When sweat, oil, dead skin, and bacteria build up on the skin, it can create body odor that is not only unpleasant, but can also lower confidence and affect social interactions. More importantly, poor hygiene raises the risk of skin infections, especially in areas like under the arms, between skin folds, and around the groin and feet. For seniors who deal with incontinence, not bathing regularly can make things even worse. The skin can become irritated, sore, and prone to incontinence-associated dermatitis, which is painful and difficult to heal. Infrequent cleaning can also make someone feel uncomfortable and less fresh, which affects both mental and emotional well-being. The key is finding a steady balance, staying clean enough to avoid health problems without drying out the skin or making it vulnerable. But how can someone know what the right routine is for their own body? Number 9, listening to your body. There's no one-size-fits-all rule for how often seniors should bathe. While guidelines are helpful, the most important thing is to pay attention to your own body and lifestyle. A person who is active, exercises, or lives in a warm and humid place may need more frequent baths or sponge cleans. Someone who is less active or lives in a cooler, dry area might do just fine with fewer baths. Personal comfort matters too. Some people simply feel better when they bathe more often. Health conditions also play a big role. For example, if someone has oily skin or a condition like seborrheic dermatitis, they might need a different approach from someone with dry skin or eczema. Talking with a doctor or dermatologist can help create a routine that works best for your body and health. The most important goal is to create a bathing routine that supports health, comfort, and a sense of dignity, one that feels right and safe every day. Number 10, adapting to life changes. Life changes, and so do our needs. Sometimes special circumstances make it necessary to change a bathing routine. For example, when someone is sick and has a fever or sweats a lot, more frequent cleaning might be needed, even if it's just with a gentle sponge bath. If incontinence becomes an issue, careful and frequent washing of affected areas is essential to prevent irritation and infections. When mobility becomes limited, or if a person is living with memory challenges like dementia, bathing can become stressful or confusing. In these cases, caregivers need to step in with both skill and compassion. The bathing environment should be warm, private, and calm. Communication should be clear and gentle. And most importantly, the seniors should be allowed to do as much for themselves as possible to preserve their independence. Caregivers must be flexible and patient. Bathing routines may need to change from day to day depending on how the person is feeling. But no matter what, the approach should always be respectful, caring, and focused on making the experience feel safe, peaceful, and comfortable. Every senior's needs are different, and finding the right bathing routine is about more than just hygiene. It's about health, comfort, and feeling good in your own skin. What about you or your loved ones? Have you found a routine that works well? What tips would you share for keeping clean, safe, and confident after 70? Tell us your thoughts in the comments. If you found this article helpful, please give it a like and subscribe for more thoughtful advice on healthy aging.